When art teacher Pat Howard relapsed to stage 4 breast cancer in 2006, her prognosis was grim: 20% chance of survival in 5 years. Pat started hormonal drugs, followed by a chemo clinical trial of Abraxane and Avastin for 1 year, followed by other chemo regimens. She has also had a procedure to eliminate recurring fluid in her metastasized lung. Pat did not do any alternative therapy at all, but as she's hypoglycemic, she's conscious of her diet and eats all foods in moderation. She eats minimal sugar, but it all comes from fruit. She does not eat table sugar. She also makes a conscious effort to keep positive. She did fear death initially in her diagnosis. She felt that each time one of her grandchildren was born, she was making room for them to come into the world. Well, Pat is still here, and now she has 3 grandkids. Death does not enter her thoughts as much anymore. She says, "Why waste energy thinking about something one cannot control?" She attributes her survival to the drug Avastin, support from her family, and keeping positive. She tries not to dwell on the negative side of her illness, but treats it as a chronic disease, much like diabetes. She still loves to shop, go to dinners, golf, and have fun. 20% chance of surviving, thriving 6 years later. The Thrive Channel congratulates Pat Howard, ultimate survivor. I am a breast cancer survivor, a blood cancer survivor.
I'm Dr. Holly Lucille, a naturopathic doctor.
I am a mom of a teenager, a bank account owner, a military wife.
My name is Dr. Deanna Atai, and I'm a breast surgeon.
I am a cancer survivor who is looking for answers just like you.
I'm Deborah Tripathi. I'm a medical oncologist.
What works, what doesn't? Welcome to Thrive with Namrata. Big question for my panel, Dr. Deborah Tripathi, Dr. Deanna Atai, and Dr. Holly Lucille. Super response in cancer for drugs like Avastin and Gefetinib and the many others. How do you say no? How do you yank something off the table when it might actually help some people live in the future?
That is a big dilemma in cancer right now. Personalized therapy. We know that different drugs match different people based on the characteristics of the tumor and also the characteristics of the host, the individual themselves. So there is a big effort by the National Cancer Institute right now to study patients that are having these exceptional responses and to see if we can find something in their genome or in the proteins of their tumor that can tell us why they uniquely had such a great response, because we might learn from that. For example, it may be that they have a mutation in a gene or they're missing a protein that could itself be attacked with another drug for people that aren't like that do make the protein or that don't have the mutation. So we can actually learn from these very high responders. Even with standard chemotherapy, if you look at patients with metastatic breast cancer, a small fraction of them are actually cured. We say that metastatic breast cancer is incurable, but there is a small number of people that achieve a complete remission and then they never recur over the rest of their natural life and they die of something else. Now, these are few and far between, but we do need to learn from them and understand why that is.
And part of the problem too is while some of these drugs are taken off the market, what you have to realize is while 10% may have had benefit, 90% not only did they not have benefit, but they may have died earlier than they otherwise would have due to the side effects of the drugs. So we're really trying to balance the overall risk and benefit, and then when we have patients that do get a response, kind of pull those aside, study them a little bit more and figure out what is it about you that caused you to respond, what is it about not only you, but you also your tumor. And then we can hopefully become more selective with who we offer these therapies for, because our therapies are very toxic. And what is sometimes lost in some of the stories is some women who were on Avastin for breast cancer did die earlier than they otherwise would have. And so it's a very difficult thing. It's hard to sometimes find that balance.
But it's such a tough thing to say to someone who says to you, but that could be me in the future that could have gotten cured if it wasn't for that drug. So it's a fine balance. So let me just ask you, doctors, how far do you think are we from actually determining those subsets, if you will, so we can actually give the treatment to those who it'll help and then not have people die prematurely as they would?
Well, I think it's, to their point, I think it's so important to not miss that opportunity when a drug works. I mean, a lot of times when people come into my practice and they're on medications, and I know the mechanism of action of those medications, and I ask them how they've been affected, I can learn more about the person's neurotransmitters, perhaps, if they're on a SSRI and actually they felt benefits. And so asking those questions about the responders, the super responders, what was different about them? What was different about their characteristics, their tumor's characteristics, their story, and then learn and learn and learn and learn. I think that's the best we can do.
But it's, you know, it's important to really not drive ourselves by what might be one story. As we discussed earlier, if the average effect is a net negative one, more people are harmed than helped, unless we can identify the ones that are helped, we really shouldn't be using a drug in a widespread fashion. So this is really a lot of work in progress. We unfortunately have not moved much closer to, for many of the drugs, to identify who the responsive population is. With some of our newer targeted drugs, we do know that certain genetic mutations clearly predict who's going to respond and who will not, but that is a minority of our drugs. I am hopeful that over time we will be able to expand on this, and the Food and Drug Administration will respond to that. Even with Avastin, if you could identify who that responsive group is, I think that with the proof, they would approve it for that situation.
Pat Howard, thank you for being an Ultimate Survivor and Ultimate Thriver. We'll see you next week.